NANN is thrilled to announce our 2019 award winners and celebrate the many contributions to our profession throughout the last year. NANN's journal, Advances in Neonatal Care, gives the Article of the Year award to recognize an outstanding contribution to the neonatal nursing journal by an author or authors. This year's recipient is Samantha ALESSI for her article titled Evidence Regarding the Use of Bubble Continuous Positive Airway Pressure in the Extremely Low Birth Weight Infant, Benefits, Challenges, and Implications for Nursing Practice. Samantha's manuscript provided useful information on a common respiratory modality in a clear, concise, scientific voice. Bedside nurses, respiratory care providers, and neonatal practitioners can identify with Samantha's commentary on the barriers and implications, identifying common NBCPAP challenges, making it especially noteworthy and deserving of the honor of Manuscript of the Year. Congratulations, Samantha! NANN's Small Grants program aims to build the research capacity of neonatal nurses. Through a productive mentor-mentee relationship, the Small Grants program provides neonatal nurses who have not been previously engaged in writing research proposals or who have not obtained research funding to begin a research project in an area of interest. Each recipient receives a $5,000 grant. These grants are made possible by support from Abbott Nutrition and Mead Johnson Nutrition. The 2019 Small Grant recipients are Rebecca South for Innovative Nurse-Driven Program to Decrease Stress and Increase Knowledge for Antepartum Mothers. Alexandra Armstrong for Toward a Transfer Readiness Tool from Level 4 Neonatal Intensive Care Unit to lower levels of care. Kelly McLaughlin Bell for Maternal Perceptions of Feeding Behaviors in Infants with Prenatal Opioid Exposure. Congratulations to all our small grant winners. The following awards celebrate the best abstracts in each award category from the 2019 submissions. They are as follows. Best Paper, Dorothy Vittner for Skin-to-Skin Contact Activates Salivary Oxytocin Release and Influences Infant Neurobehavioral Functioning. Best Poster, Leslie Parker for Effect of Aspiration and Evaluation of Gastric Residuals on Intestinal Inflammation, Gastrointestinal Bleeding, and Gastrointestinal Peptide Levels in Extremely Preterm Infants. Best Clinical Abstract, Ashley Weber for Organizational Resources for Family-Centered Care May Influence Clinicians' Attitudes Toward Family Engagement. Best Research Abstract, Christine Wetzel for Maternal, Infant, and Nutritional Factors Influencing the Developing Microbiome of the Premature Infant in the NICU Setting. Best Evidence-Based Practice Quality Improvement Abstract, Genesee Hornung for Boosting the Bundle, Implementing Practice Changes in a NICU to Reduce CLABSI. Congratulations to our conference abstract winners! The NNP Excellence Award is presented to someone passionate and committed to advancing neonatal nursing and improving the outcomes of patients and their families. This year we are pleased to recognize Dr. Susan Almarode. Susan successfully increased the amount of kangaroo care in her unit after recognizing the importance of the intervention, creating guidelines for transfer, and teaching and encouraging staff to carry out the intervention. After identifying that there were gaps in the teaching and preparation for families of infants with multiple medical needs, Susan developed a team model in her NICU that improved collaboration among hospital teams, which led to more prepared families and safer discharges. When not helping some of the tiniest patients, she supports the Neonatal Nurse Practitioner Master's Program at the University of Virginia and is an on-site coordinator for students who seek to do their clinical time at UVA. It has been said by her peers that Susan has a true gift for precepting and teaching future nurses. Susan's passion for improving the outcomes for patients and her families also shines through in her Doctor of Nursing Practice final project. Titled, The NICU Reading Garden, the project encourages mothers to read to their babies and shows promising results in treating postpartum depression. We are so proud of the work Susan has done and continues to do to better patients and their families. Congratulations, Susan! The NNP Rising Star Award recognizes someone who exemplifies passion for their work and is making a large impact in a short time through exemplary practice, leadership, service, and education. This year, we recognize Priscilla Meyers. While many are discouraged by chronic scheduling shortages, work stress, and constant turnover, Priscilla was moved to action, voluntarily helping to rectify the situation at her Level 4 NICU. She has helped build bridges with the NICU nursing staff so that her unit is working more cohesively than ever before. In 3 years since becoming the manager for the neonatal nurse practitioners, her unit has become fully staffed and a desired education program for NNP students. Recognized as a highly evaluated preceptor for NNP students, Priscilla continues to try and ease the transition for young nurses and new hires. Priscilla has overhauled the orientation processes for fellows and tailored a formal orientation to the specific experiences and needs of the nurse practitioner. With Priscilla's influence, individuals can now successfully transition from students to new graduates to confident care providers. As a leader in growing a NICU, Priscilla has scheduled quarterly meetings with NNPs to address accomplishments, encourage discussions on timely issues, give a voice to her fellow peers, and boost morale. Priscilla has been able to make great strides as a manager, and we look forward to see what continued positive influence she can have on her NICU and beyond. Congratulations, Priscilla! The Distinguished Service Award recognizes outstanding and dedicated service to NANN by honoring an individual who has advanced the mission of the association in a significant and lasting way. This year's recipient is Dr. Xenia ZUKOWSKY. Xenia has been an active NANN member for over 30 years, where she has dedicated her time and talents most notably to NANN's journal, Advances in Neonatal Care. Joining the editorial board in 2001, she has been committed to supporting the often inexperienced author. Xenia has dedicated countless hours to reviewing manuscripts, providing thoughtful comments, and acting as a mentor for the novice writer. Her selfless service has helped and encouraged many authors to develop and publish their work. When not providing service to the NANN Journal, Xenia lends her talents to the March of Dimes Services Advisory Board New Jersey, non-PFF, the Philadelphia Perinatal Society, and the American Academy of Pediatrics and American Heart Association. She is currently chair of the graduate program at Jefferson School of Nursing and a part-time NNP at Thomas Jefferson University Hospital. We thank Xenia for her service to NANN, advances in neonatal care, and the neonatal nursing profession. Congratulations, Xenia! The recipient of NANN's Navigator Award demonstrates outstanding teaching and motivational skills, is clinically and technically skilled in the profession, and willingly shares expertise. This is embodied by this year's award recipient, Kelly Gilhousen. Kelly Gilhousen has worked for the Metro Health System for 23 years. In this Level 3 NICU, Kelly has thrived as a neonatal clinical nurse and education coordinator. We are honored to present Kelly with this year's 2019 Navigator Award, as she exemplifies the power of mentorship. As part of Metro Health's CARE program, Kelly has been instrumental in sharing her knowledge and expertise with newly hired RNs to ensure successful practice transition and incorporation into the NICU staff. She is developing and providing meaningful educational offering to enhance staff development opportunities and positively impact patient care delivery. In her unit, Kelly has started a series of monthly multidisciplinary education topics that are provided to the staff during work hours to promote ongoing education. Kelly's passion for education and precepting has led her to currently pilot a peer-to-peer mentorship program for preceptors, with the goal of standardizing orientation, improving patient outcomes, and decreasing turnover. It is undeniable that she proves to be a strong mentor, leader, and educator. We can think of no one more deserving for the 2019 Navigator Award. Congratulations, Kelly! NANN's Leadership Award aims to recognize members who can mobilize and unify others for the improvement of neonatal care. This year, we are happy to award Jennifer HART. Jennifer is a current nurse manager at the Children's Hospital of Philadelphia. She formalized and now chairs the first retention committee in her NICU after realizing how low morale and how high turnover was for NICU nurses. She started the Lifesaver program, which helps promote peer-to-peer positive feedback between nurses, hoping to boost morale and a sense of community within her unit. On multiple occasions, Jennifer has led the event Share Our World, which showcases the role of NICU nurses and works to bridge the information gap between hospitals and home. As a nurse manager leader for mid-level managers in her hospital, Jennifer was instrumental in standardizing orientation, formalizing mentorship programs, making online resources available, and developing quarterly professional development summits. She continues as a nurse manager leader for the professional development work for frontline leaders, helping create robust online resources, toolkits, and communication platforms. Jennifer is not only a leader at her hospital, but also within the NANN Delaware Valley chapter, where she is a past treasurer and currently the director of DVAN's Baby Buzz podcast. Congratulations, Jennifer! In 1989, NANN established the ROBYN Maine Excellence in Clinical Practice Award. This award is given in honor of Robyn Maine, who was a staff developmental specialist and perinatal clinical nurse specialist. Her dedication to patients, families, and neonatal nursing in spite of a battle with terminal cancer was one that continues to be a source of inspiration for our profession. So it is befitting that the recipient of this award be someone who recognizes and encourages excellence in neonatal nurses who provide direct patient care. This year's recipient is Barbara O'Rourke. Barbara has been described as an excellent bedside nurse, leader, and mentor. Her passion for quality drives her research of best practices, evaluation of outcomes, and implementation of change to provide exemplary direct patient care. We are honored to recognize Barbara O'Rourke with this year's ROBYN Maine Excellence Award. Barbara has successfully implemented side-lying bottle feeding, supported oral feedings in fragile infants, and promoted the use of positioning devices to promote neurodevelopment. Barbara is willing to go above and beyond to make sure that her patients are receiving the best care and to conduct original research in order to find what is best for her patients. Barbara has gone on to produce videos, brochures, and help develop educational programs in order to share her findings and better inform fellow nurses and babies' families. Currently, a medical mission program is in the process of making her education resources on elevated sideline bottle feeding available to Jamaican NICU. We are thankful for the work that Barbara is doing to make sure that her patients and babies everywhere receive the best possible care. Congratulations, Barbara! The Lifetime Achievement in Neonatal Nursing Award recognizes an individual's long-standing commitment to and profound impact on the field of neonatal nursing. This year, we are thrilled to present 2 Lifetime Achievement Awards. Mary Ellen HONEYFIELD has been called a pioneer of neonatal nursing. Participating in the first NNP program at the Children's Hospital in Denver, she has been instrumental in teaching future NNPs and developing national certification examinations for NNPs, NICU nurses, and low-risk neonatal nurses. Mary Ellen has worked as a staff nurse, NNP, clinical nurse specialist, unit manager, and director of perinatal services. She started NNP Services of Colorado and Innovative Healthcare, which provides NNP services to various hospitals, provide nursing education through conference, and consult for NICUs across the country. She has mentored countless NNPs, served on a multitude of committees, spoken at conferences, authored several articles and chapters, and helped co-edit the physical assessment of the newborn, which is used by most NNP programs, and recently celebrated 25 years of publications. Mary Ellen has always had a love for teaching and continues to teach in the Regis NNP program. You do not need to be a student of Mary Ellen to have benefited from her insight and wisdom. Through her grand influence on the larger neonatal nursing world, we have all benefited from her in some way. Mary Ellen has worked tirelessly to make sure that every baby has the best possible care. It is without a doubt that Mary Ellen has made the world of neonatal nursing a better place. Congratulations, Mary Ellen! And now for our second Lifetime Achievement Award winner. With over 30 years of experience, Terry Johnson has been a neonatal nurse, transport nurse, clinical educator, family nurse specialist, faculty coordinator of a National Neonatal Nurse Practitioner Certificate Program, and a clinical neonatal nurse practitioner. She is founder of Lodestar Enterprise, which serves as a consultant to numerous healthcare systems, perinatal advocacy organizations, professional practice groups, as well as numerous healthcare industry partners. Terry has been honored with many awards throughout her career, some including the Laurie Edmonds Lectureship Award from the University of Massachusetts Nursing Division and the Brandon E. Griffin MD Memorial Lectureship Award from the University of Massachusetts School of Medicine. Terry has been praised for being a compelling speaker and advocate for neonatal care. It has been said that she has the ability to deliver complex content in such a way that is easily understood by even the most novice clinicians. Her ability to connect and communicate so well with others has led to her becoming an internationally known speaker and educator. Terry currently works part-time with Prolacta Bioscience as a consultant for safety and quality in human milk banking, product development, clinical education, clinical research monitor, and professional development. Terry continues to educate and inspire fellow nurses. We are proud to present her with this award today. Congratulations, Terry! "2019 award winners, please stand. Thank you for your commitment and contributions to the neonatal nursing profession. Please join us in congratulating our 2019 award winners.